All right, so maybe one of the most frustrating things about migraines is when you can't control a trigger, like weather. But weather triggered migraines will actually tell us a lot about what's causing your migraine. So I'm going to give you three of the major reasons why weather might trigger something for you. And even more importantly, share with you how you can determine which of those three areas might be what's causing your weather triggered migraine. And maybe even more importantly than that, what you can do to try to help stop it. So if you have watched any of my videos, number three is going to sound really familiar. I talk about it quite frequently, and it's one of the most common reasons for weather triggered migraine. So stick with me. So my name is Dr. Tanya Paynter. If you are not familiar with me or haven't watched any of my previous videos, I am an ex-migraine sufferer. I'm a naturopathic doctor who now specializes in helping women with chronic migraines to identify the underlying biochemistry imbalances that are contributing to their migraines and helping them fix it so that you don't have to continue worrying about when it's going to hit, skipping, fun family events, not being able to go on vacations, all the stuff that comes with having to deal with these on a regular basis. So one of the things that I hear, one of maybe the greatest frustrations about migraines and specifically migraine triggers is when it's caused by weather, because it's completely out of our control. There's nothing, you can't eliminate weather, just like you can't eliminate sun, you can't eliminate, going outside and smelling strong smells. So some of those triggers can be super frustrating because you can't do anything about it. And weather more than anything else, because you can't run away from it. So if I told you that being triggered by a storm is a key piece of information that's going to help us understand a little bit more about your migraines, what would you say to that? Most people are like, I don't even know what that means. So let's talk about the three major reasons why somebody is triggered by weather and what that means for you and what might be going on for your migraines, okay? So number one is the pressure change itself. So storms always come in with drops in pressure, or I should say pressure changes. Most of the time with stormy weather, it's actually pressure drops. What happens with that is that the perceived pressure in our head is it increases, right? So if you remember your physics, when you have one, you have a constant pressure on both sides. And then when one drops, relatively speaking, it seems like the other side will increase, right? And so that's kind of what's happening in our head, in our sinus cavities, is when our pressure is dropping, our brain is triggered to think that there's higher pressure in our brain. And so then what ends up happening is that will trigger that kind of pain cascade that then will trigger a migraine. And so the trigeminal nerve will fire inappropriately, and then, suddenly we're down and out. So there's actually a breathing technique that you can use. And I wouldn't necessarily recommend doing it unless there is this pressure change, because when I did it first, when I first started learning this technique, I actually got so lightheaded I had to go lay down. So it actually can really work to help to relieve the internal pressure. And it's called hypopressive breathing. So if it's not something that you've ever heard of before, it's almost like holding your breath and then trying to breathe in. And what that's doing is that's actually changing the pressure internally based on all kinds of stuff that I won't even get into. But that will allow our body to kind of almost normalize the pressure between the outside pressure drops and the internal high pressure that's happening. And that can actually really help to relieve some of the pain, especially as the storm is coming on. And if you can kind of help control some of those pressure changes so that it's not happening so quickly, then that can really give you some relief. So I'm not going to go into the technique right now. You can actually just Google hypopressive breathing, and I'll put I'll write it up in the notes as well, so that you know how to spell that. All right. Number two is mold, believe it or not. So high humidity and pressure changes are suspected mold spore triggers. And so what this means is that when we have a storm front rolling in, and the humidity is changing, the temperatures are changing, the pressure is changing, all of these things can trigger mold spore release. And so if you have an underlying mold issue, either an allergy to mold, or you have, an actual mold infection going on that triggers that immune reaction, then that can actually increase the spores to the point where it's like almost like a sudden pollen release, right, to somebody who's got allergies. And then they just start, getting all kinds of symptoms and are miserable. Same kind of idea with the mold spores. So if storms are an issue and or humidity is an issue, or conversely sunny days, so actually some of the higher temperatures, the different types of mold will either spore during high humidity or spore during like higher temperatures like heat and dry. So if either of those types of days are triggers for you, then really seriously consider digging into whether or not mold is an issue. And so that would be something that you can talk to your doctor about, testing for mold toxicity. So there's a couple of different things. There's ochratoxin A that you can look at. There is some mycotoxin blood testing available. So there are some different tests that are available through blood. And then you can also actually get some more specialty testing done with some of the comprehensive mold test through. There's like a Great Plains lab that has a mold toxicity panel, and that's actually the one that I use most commonly. So that's the one that comes to mind. But definitely talk to your doctor about screening for potential mold as a trigger for you. All right, the third and the most common reason for storm-triggered migraines is actually relating to serotonin. So I've talked about serotonin multiple times in other videos. So if you're starting to kind of hear a pattern for you in the symptoms that are coming up and the triggers for you, and serotonin seems to be a common link, that's something you really got to look a lot closer at. What's going on with your serotonin pathways, and why is that a problem for you? How is it out of balance? So that you can work on getting it back in balance, so then you can move forward with the migraine progression, okay? But several studies will actually link low pressure or pressure drops with drops in serotonin. And we also know that serotonin drops is a known migraine trigger. So it stands to reason serotonin drops during stormy weather. It's one of the suspected reasons why seasonal affective disorder is such an issue, because in wintertime, we usually get a lot of stormy weather, low pressure systems rolling in, and our serotonin levels, if we're already struggling with that, serotonin drops, and then we start getting more depression symptoms, right? So that makes sense. So the same kind of idea is happening here with a storm rolling in. So a couple other things to kind of take a look at to see whether or not serotonin might be the main source of issue for you versus the mold or the pressure change is if triptans actually help reduce. It might not take away a storm-induced migraine, but if it helps to, mitigate how long you have one or the intensity of it, then that's going to be kind of a key thing to pay attention to. The other thing is any other symptoms that go along with it. So if you get a lot of nausea, if you get depression or anxiety symptoms along with it, that's another piece of the puzzle as well. And so that could be really important to note. What kinds of symptoms do you get when you have a migraine triggered event? Because then those symptoms, if they correlate with that low serotonin or a serotonin drop, can give you a better idea that yes, indeed, it is this issue. So treatment for this, I've mentioned it several times before in different videos. So before I go into it, I have to do my serotonin caveat. If you're on SSRIs, if you're on any triptans, if you're on other medications that increase serotonin, you have to talk to your doctor before you even think about starting 5-HTP, melatonin, St. John's wort, anything like that, because too much of those serotonin boosting things can actually push you into something called serotonin syndrome, which can be deadly. So make sure that you clear it with your doctor if you're on any other medications that affect serotonin. If you don't know, then you need to talk to your doctor, okay? All right, that being said, serotonin boosting nutraceuticals can be really helpful as a first line preventative and or abortive in weather triggered migraines if serotonin is an issue for you. So 5-HTP, anywhere from 50 to 200 milligrams dosing should be given by your doctor. And in combination with melatonin, anywhere between, again, 0.5 milligram to 5 milligrams have been studied. So those two in combination can really help to boost your your serotonin levels and can help to prevent those drops. And so you can actually kind of maintain it with multiple dosings. Again, dose dependent on what your doctor recommends. but through the storm system to kind of keep those levels elevated. So you can dose yourself, 2, 3, sometimes 4 times a day to kind of help with that that process. And St. John's wort, it's a fairly well studied herb. It's as effective as SSRI medications in boosting serotonin, so that can be another option to consider taking as well. And I have had some clients that have success with it, although most have success with the 5-HTP melatonin combo. So this information here, this is a really, really critical piece of information for a lot of women with migraines, because they just have no idea that the reasons behind their weather-triggered migraines can be treated, and that they actually can feel better and not be so, wrapped up in weather. And I have a few clients who actually, they lived their life based on their weather app. They would look in the future, if there's any kind of storm, anything coming in the 10-day forecast, they would not make any plans. They would kind of hunker down. They would plan on having a several-day migraine as it passed through. And they don't have to do that anymore. They've learned, to identify when they have their early symptoms. And some of them actually don't even have to medicate, period, even with the 5-HTP melatonin, because they've been able to work on their serotonin pathways. They've been able to work on addressing the mold toxicity issues. And that has made a world of difference for them. So I know that it seems like this is something that you can't control or change, and that's completely not the case. You can actually change, so you don't have to live your life based off of the weather app. So if this hits home for you, and you know anybody else who is struggling with this same trigger and with these same issues, please share this video with them, because I think this is so information, and I have never heard anybody else share it before. And I think that it's really important that that everybody understand that if we can identify the underlying reasons, and we have science that shows us some of the things, some of the changes that happen physiologically during these kinds of weather changes, then we know where we can go from that, and you can start tracking that information so you understand how you can actually treat yourself. So please share this video with any women or groups that you know that are struggling with weather-triggered migraines, and let them know that there are other options, so that they don't feel like they're just at the mercy of things completely beyond their control. All right, so that is it for today. Hope you got benefit out of it, and we'll see you next time.